Thank you very much, Presiding Officer. And I note that we're looking at today's debate, and I appreciate that we're looking at today's debate from what has been broadly a consensual approach. And given that I'm famous for taking such an approach in my speeches, I'll look to continue the theme. A number of suggestions have been made by members, and I think I might contribute some suggestions of my own, because I recognise the pressures that the NHS faces. I think we all recognise the pressures that the NHS faces. My colleague Kevin Stewart referenced the meeting that we held with NHS Grampian, at which the Cabinet Secretary attended, to discuss some of the issues that are facing the primary care sector in particular in the Grampian area. And in my own constituency recently, the Brimon Medical Group announced its decision to withdraw from the provision of general medical services as of the 1st of October due to upcoming GP retirements and a difficulty in recruiting to the practice. And a letter was sent out to the 8,300 patients of the practice, of which I am one, advising to this effect. And discussions with NHS Grampian have established, firstly, that the patients will continue to have a GP service in the area, and discussions, I'm aware, are ongoing in relation to that, and there is a process that is being followed. I think one of the things that it's highlighted, though, and that I will continue to highlight with the Health Board, is that at a point at which a practice is facing pressures or deciding that the GPs are going to withdraw from providing general medical services and the practice faces closure, there's a need for ongoing communication and collaboration with the practice itself, as well as looking to the future provision, because there are obviously issues around retention of existing staff and the TUPE arrangements that could be put in place, and there needs to be that ongoing dialogue. But I think what it also highlights to me is that there is an opportunity, I think, to look more closely at what we're doing in terms of primary care and the way in which we're accessing primary care. I think NHS Grampian have said that one of the things they want to look at is a more confederated model. So instead of individual practices operating in small areas, which can obviously put pressure on GPs to take on partnership roles, looking at the possibility of a practice having a number of premises across communities delivering services, where therefore you're only relying on a small number of the overall cohort of GPs to take on those positions, because one of the things that's been highlighted is a difficulty in attracting.
Microphone for Mr. McDonald, please.
I'm sure you only missed a little bit of that quality contribution I was making, Presiding Officer. Now, I think, just to rewind slightly and start again, one of the difficulties that's being faced is attracting new graduates into general practice, and I think that one of the reasons for that is the view that is held by graduates that they would be required to take on some of the responsibilities of partnership, which many of them perhaps do not want to take on alongside the role itself. Also, on top of that, the fact that a larger number of general practitioners now are part-time and female, compared to the previous model where you had a larger number of male GPs working full-time. That needs to change the way in which general practice is delivered. And I think when we talk about pressures on accident and emergency, we talk about people presenting an accident emergency who ought to be presenting at their GP surgery. And I think we need to drill down a bit further and look at GP surgeries and where people are presenting at their GP surgery, where they might be better dealt with by another health professional. For example, nurse practitioners. And I've highlighted in this chamber before the good example of the Middlefield Healthy House in my constituency. And I know that the Minister, Jamie Hepburn, is going to come into my constituency to visit that facility next month. And I look forward to joining him on that visit. But also pharmacists and other allied health professionals have a role to play, I think, and we need to ensure that there is an appropriate triage process in place, because in many cases when an individual phones up their GP surgery, they can be given an appointment with a GP without there being any examination of what the issue is they wish to discuss, and it is only at the point at which they are presenting to the GP in the consulting room that the GP might think, well, you should really be going to the pharmacist rather than coming to see the GP. So I think we need to get better at how that is dealt with. I think the other thing that faces GP practices, certainly in my constituency and I suspect elsewhere, is the pressure of development as well as the pressure of demography. A large amount of planning applications are going in my constituency, which will add pressure to existing GP practices, which are already either at capacity or getting very close to capacity, some of which, Dainston being one, which are operating within very constrained physical premises and don't have a lot of room for expansion, or indeed any room for expansion. And I think we need to look at how we utilise both planning gain but also other funding streams to expand and develop practices, and whether that needs to be done in a more collaborative approach. Finally, Presiding Officer, on the issue of the care sector, I thought my colleague Bob Doris made some very important points around career pathways. We've seen in my constituency the Bucksburn Care Home being closed and abandoned by Pepperwood Care, the previous owners. It was viewed, I asked if NHS and the Council would look at the possibility of establishing a step-down facility similar to that at Clashy now, which has helped and will help in terms of dealing with delayed discharge. I was advised that the cost of bringing it up to a suitable standard was too high and that it was not seen as a suitable facility for that. I do know, however, that there are talks going on between Scottish Government, NHS Grampian and Aberdeen City Council around possible future uses for that facility, which will help drive improvements in the care sector, and I look forward to hearing more on that in the near future. I do think, though, that in terms of the care sector, one of the things that we have to maybe look at is whether there is a way we can develop a model and develop an approach that can chip away at what I see as the difficulties that have been caused by the genie being let out of the bottle by the privatisation element coming into care home provision, and whether there are ways and means that we can address some of the challenges that has presented.